Hello, everybody. We're just gonna give it a couple minutes here to let our participant field fill out. Elizabeth, I see you raise your hand. Do you want to, I can allow you to ask a question now if you want, or we have questions at the end. So I'm gonna allow you to talk if you would like to unmute yourself.
Hi, no, I'm sorry. I accidentally pressed the
Oh, okay, no worries. That's what I figured, but all good. I'm just gonna take off your talking. Okay, great. And I'm gonna lower your hand as well. Looks like our attendee is still kind of going up here, so we'll give it a couple more seconds. And I'm sure we'll get a couple more people popping in as well. Yes, Michelle, it is okay if you have to leave early, anything like that. This webinar will be recorded and posted to the ILRU website within 48 hours. Okay, so kind of slowing down with our attendee field population. I'm sure we'll gain a couple people as we go, but I'm going to get started. So hello, everyone. My name is Jenny Sitchell. I am the operations director at the National Council on Independent Living. I help coordinate logistics for these webinars, and I wanted to welcome you to today's webinar, Creating a Culture in Your CIL to Guide Mental Health Transition. Today's presentation is brought to you by the Administration for Community Living at the U.S. Department of Health and Human Services in conjunction with the ILNet. The ILNet is operated by ILRU in collaboration with NICL, April, and the University of Montana. Giving you a brief on myself, my pronouns are she, her. I'm a white female with curly brown hair that is swept over to one side, wearing a green kind of tank top business shirt. My background is a lovely Zoom background that is a study with a fireplace and a lot of books. It's not my study, it's totally virtual. I wish it was my study. Now, for a few housekeeping details. Captions are available on this webinar. You can click Show Subtitle in your Zoom menu bar to turn them on. We also have captions running at AI Media. The URL is a little too long to read, but we will share it in the chat box. AI Media will allow you to enlarge the font and change the color and contrast of the captioning. ASL interpreters are also present today and should always be visible as we are presenting in gallery view. Please let me know if you cannot see the interpreters via the chat, raising your hand and asking a question, or via the Q&A. In addition to ASL today, we also have Spanish translation available. In order to access the Spanish translation, you can go to the Zoom bar on your screen and choose the language you would like to hear the presentation. Good news though, because you don't have to be on Zoom video to access the webinar. We will read all slide content and all questions out loud so that everything will be available to individuals calling in on the phone or who cannot see visual content. We do have public chat turned off, but you are still able to chat with the panelists. We ask that you reserve the chat for requests for technical support only, and please try not to use the chat to submit content-related questions. Speaking of questions, we will be answering all questions as time permits. You are welcome to submit your questions throughout the webinar, but please note that they will be held until the end of the webinar during the Q&A portion. In order to submit your questions, there are a couple of easy and accessible ways to submit the content. If you're on Zoom, you can simply type your question into the Zoom Q&A tab. You're also welcome to email your question to me at jenny@nickel.org. That's JENNY@NCIL.org. I'll also put my email address in the chat box today before the Q&A break. Finally, if you're on the telephone, you can press *9 to indicate that you have a question. When we select you, if you're using touch tone phone, you can push *6 to unmute yourself. We ask that if you are speaking a question, please limit the question to no more than 30 seconds though. We also ask that you complete our evaluation. Okay, this is like serious now. We take our evaluations extremely seriously, and we use the information that we learn to improve our future trainings. Takes all of probably about 30 seconds, a minute to complete the evaluation, but it results in better content and better webinars for everyone. So the evaluation box will open when you close out of the webinar, but we're also going to put links to the evaluation throughout the webinar in the chat box. We would be so grateful if you can take just a few moments to complete the evaluation. If we can get up to 50% of you completing the evaluation, that would be absolutely fantastic. That's like dream right there. So I think we can totally do this. Let's aim for it. Now, before we introduce our presenters, I want to just go over our learning objectives today. So please note that our overall goal, sorry, I was just transitioning between a couple slides here. Our overall goal of this webinar is to help you all better understand how to create a sense of belonging and support in your CILs and organizations by looking at the culture surrounding mental health in the workplace and with the consumers. With this in mind, our learning objectives today are to identify strategies to create a CIL culture that supports mental health transitions, understand how your CIL culture surrounding mental health can influence mental health transitions, and to identify best practices for working with your CIL staff to grow your programs and work with mental health transitions. So once again, fill out the survey. We'll put it in the chat as well. And now it is my pleasure to introduce our panelists. I'm going to introduce them all at once, and then I'm going to ask each one of them to come up and introduce themselves briefly. So we have Dr. Sharon McLennon-Wier, we have DeAngelis, we have Jessie Bethke Gomez, and Sarah Wendell Launderville. So I'm going to ask Dr. Sharon, can you please come on screen and introduce yourself? And give me 1 second, Dr. Sharon, before you do that. I just want to make sure that you're spotlit. Okay, go ahead, Dr. Sharon.
All right, good afternoon, everybody. As you know, my name, Dr. Sharon McLennon-Wier. I am the Executive Director for the Center for Independence of the Disabled, New York, Sydney. And I'm happy to be here to talk about a very salient issue in working with people with mental health issues. I am a Black woman. I have blue eyes. I am a totally blind person. I'm sitting in my work office here at Sydney, and I am wearing a Black suit with a lavender color top underneath the suit jacket. Thank you.
Great, thank you so much, Dr. Sharon. Next, I am going to have DeAngelis come onto screen and introduce yourself, please.
Hi, everyone. My name is DeAngelis, and I'm the Program Coordinator for Mental Health Services at the Center for Independence of the Disabled, Sydney. I am a white woman with shortish, blondish hair, but it's tied up into a clip right now. I have large blue earrings and a yellow sweater that is a little bit of a chunkier knit, and it's a turtleneck. And I'm very excited to be here to talk about mental health, as this is my passion, this is my career. I do have a background in mental health counseling, so I'm excited to be able to talk about that here. Thank you.
Great, thank you, Anne. Next up, I'm going to invite Jessie to the stage, and go ahead, Jessie.
Good afternoon, everyone. I'm Jesse Bethke Gomez, the Executive Director of Metropolitan Center for Independent Living. Super happy and excited and very, very pleased that we're having this session today about mental health and creating this culture of welcome. I'm a former president of a behavioral health firm, and so I spent many, many years looking at advancing the sense of connectedness, wellness, and a culture that is one of belonging. I am a male, I've got dark hair, and I have a dark suit on and a bow tie, and I'm happy to be here. Thank you so much.
Thank you so much, Jesse. And rounding it out, Sarah, do you mind coming on and just giving a brief intro?
Hi, everybody. I'm Sarah Launderville. Use she, her pronouns. My visual description is I'm a white woman wearing glasses. I have brown medium length hair, and I'm wearing my CIL sweatshirt. I'm a psychiatric survivor, and I'm the executive director of the Vermont Center for Independent Living, and so happy to be with you all today.
Great. Thank you so much, Sarah. So now it's time for the good stuff. We're going to get started. And so I'm going to ask actually Anne and Dr. Sharon to kind of come on the screen and discuss a little bit, frame the discussion. And can you answer the question? Why is it important for CILs to care about and support, went to the wrong slide, and support the mental health and well-being of their staff and consumers? And I will let either of you kind of take the floor as you see fit, and then we're going to pass it over to Sarah when you guys are done.
Okay, I'll start. Essentially, what's important to understand here is that the CILs, it goes with our history. Our history has been to break down barriers so that people with disabilities can live independent lives in the community. A big chunk of our historic ties have been breaking down those physical barriers for people that have physical disabilities. And what we want to highlight today is that people that have mental health disabilities are just as important as those that have physical disabilities. And there's still a lot of stigma, a lot of barriers, a lot of ignorance regarding that. And since we are working in Center for Independent Living, we need to understand that mental health disabilities are not apparent. Sometimes we call them hidden disabilities, but they can be long lasting and can impact one's quality of life. So the services that CILs provides to help with someone's level of independence are so crucial to those that have mental health disabilities. And
Yeah, and to kind of follow up Dr. Sharon on that, the work that CILs do in benefits work and equal access to their environment, it's just that beginning of mental health care. Because in order to start to work on that higher level of mental health care, we need to feel safe and secure in our daily life, to have that energy to be able to continue to work on mental health. So in Maslow's hierarchy of needs, our basic needs are on the bottom of this pyramid. So if you can imagine a triangle, that bottom section is the physiological needs, food, water, shelter. And right above that is a bit of that feeling of safety, feeling as if we have those resources that we need. And we need those bottom foundations in order to start to work on that higher sense of mental health. So we are doing that beginning work at CILs. However, we need to take those extra steps to help somebody work through that higher level, and having our consumers reaching out for support and building that foundation is crucial, but cutting them off at that point is not fulfilling all of their needs. We need to look at a person as a whole individual rather than just those physical barriers and those physical needs. Our mental health is just as important as our physical health. And it's difficult to process that mental health when we're in that feelings of unsafe environments where we're feeling like there's systematic barriers in our way. So we're doing some of the work, but we need to go that extra step and start working on that mental health piece as well.
Great. Sarah, do you have anything you want to kind of add into what they just mentioned on that?
This is Sarah. I think everything you said was wonderful. I think that the reason to care and support mental health is really once we stop paying attention to that, right, our systems are never going to improve. So if I look from our experience around systems of psych survivors where we're locked up, our kids are taken away from us for forced sterilization, lots of very harmful systems. And some of those policies, some of those laws are still in place where we're, lots of the hospital systems want to build more beds, the other community systems are not doing what we really need or want in order to really improve the lives. So I think that if we're not paying attention, we're going to lose, some of the laws and experiences that we've had so far, and we're not going to really gain anything more. So I really kind of like to think of it from that lens of advocacy.
I love that. And I fully agree with that sentiment. So does anybody else want to kind of add in anything on this question and how we're framing our discussion today? And if not, we'll kind of move in. Go ahead, Anne.
So oftentimes in health systems, we're looking at that physical model, that medical model, and it's really important to shift the script in looking at the person as the whole, like I had said. So attending to every bit of a person is just as important as looking at that medical model piece. So if we're only looking at the medical model, we're completely ignoring a whole part of a person that impacts our well-being. We are one body, and the way that we think impacts our bodies, and the way that our bodies work impacts our mind.
Yeah. Dr. Sharon?
Yes,
Go ahead.
I just wanted to add that the whole movement of independent living was to initiate this whole concept that I'm like you, you're like me, that you could have a disability and still be able to live freely, independently in society, be able to work, be able to have a family, be able to travel, be able to vote, be able to get on a bus or to drive a car, or whatever mode of transportation you're able to do. And regardless of what the disability is, you still need to be able to be included in society. And what has happened over time, especially with those that have mental health disabilities, is that there's almost a segment of barrier between disability types. And as advocates, we really need to work against that and ensure that every disability is allowed to have access to the liberties of life. Also, we have a lot of consumers that have multiple disabilities. So they can have a physical disability as well as a sensory and a mental health disability. And not one of those disability types are more important. And having the trifecta, multiple disabilities, in addition to intersectionality of race, gender, sexual orientation, religion, and having that level of minority status can be very overwhelming for someone that has multiple disabilities, including mental health. Thank you.
Thank you so much, Dr. Sharon. With that, I think I'm going to move on to our next question because I think that's a good segue into it. So our next question is about prioritizing mental health. So I'm going to probably have Sarah join us first on this one and just describe how your CIL prioritizes the mental health and well-being of its staff and consumers. Provide a few specific examples of how it respects and supports the opinions and lived experiences of staff and consumers with mental health disabilities.
Sure. This is Sarah. So I think for us, if I go back to what Dr. Sharon was talking about initially, like a lot of our centers started out around really supporting folks who have physical disabilities. And our center started in 1979, sort of the same, our bylaws started that way. And in the 80s, we saw this shift, right? That there are people from the survivor movement, people that had mental health disabilities coming forward and saying, we're really part of that. And, we started to then prioritize, how do we include that voice, and how do we sort of look at the policies we have, look at our procedures that we have, and how are we alienating people or meeting some unintended consequences around how that looks overall. And so we started to change the makeup, our board members, our staff, And then we started to really shift and have conversations around stereotypes and what led to bias and discrimination around mental health as a whole, as well as folks who have psychiatric disabilities. And I think that that's where we started to see some of that shift in how the inclusiveness of folks with disabilities, not only in the makeup of the organization itself, but then if I look at, like, again, when I go back to the advocacy work, the systems work that we do, listening to the experiences, when we look at evaluations of folks, what their experiences are in the community, and how do we shift that to like a systems level approach around how do we take those lived experiences and work in the community to make sure that we're shifting overall. So I think, making sure that we're just really listening and then responding, and having people with those lived experiences really bolster up. And I think I really appreciate Dr. Sharon's conversation around, this is looking across the board, and especially examples of advocacy work in terms of if people have multiple disabilities, and how does that really look within the community when there's barriers that we're experiencing. So I guess I'll start us off with that.
That was great. I'm gonna go back to Dr. Sharon and do you guys have anything you want to sort of add into that or add on to that you see at your cell?
Yes. Oh, sorry. What you guys hear is my JAWS screen reader. Sorry about that. Okay, so at Sydney, we look at the person as a whole. And we have a lot, we're located in New York City. We cover the 5 boroughs. And we have a lot of consumers that have mental health disabilities who are seeking services. And essentially, typically, most schools don't provide mental health services. And we need to think about how that would look in trying to keep with the philosophy of inclusion and focusing on the social model of disability rather than medical model. But one of the things that, as a psychologist, I think is important to understand is that to understand disability, the clinician needs to understand how to work with the population. So at Sydney, we're focusing, one of our initiatives is on cultural competence, disability, multicultural competence, and teaching clinicians how to work effectively with consumers that presents with mental health disabilities. For them to understand what that looks like, what interventions will work, how to really listen to the client, listen to the consumer, understand where he or she have to say, and how the disability has impacted their life. We understand the intersectionality of race, gender, sexual orientation, and all those other facets, and how it plays in the psychological aspects of disability and that person. So that's one of the things that we're doing, but Anne can also add to other things that we're focusing on. Anne?
Yeah, and kind of to jump off of that point, it's really important to just talk about mental health with all of our staff, making sure that our staff understands the signs and symptoms of somebody who is experiencing a mental health crisis. I know with the staff that I work with, I've asked them to do a training called CSSRS, which is a crisis training that is it's a way of doing suicide assessments. However, it's not for mental health providers. So it's for anyone to be able to have that foundation, just so we know when to call in professionals to do that further assessment. Anyone who is talking to consumers should have some sort of crisis understanding, so you can know those types of like red flags that pop.
Sorry.
Oh, no worries. So we can know those red flags that pop into your mind when certain words are said, so we know what questions to ask and follow up for, so we can make sure that somebody has a well-rounded, supportive approach. I did see in the chat that someone was asking about where we can access the CSSRS training. It is available online. If you just Google CSSRS, you can find it. And then when I get off screen, I'll go on to Google and I'll send that link in the chat as well. But just to kind of finish up my point, it's important to have these just a baseline information, even if these professionals that are in Sydney or in your organization aren't working in a mental health capacity. It's good to have everyone in our lives have a basic understanding of crisis.
Great, thank you guys so much. Does anybody want to add anything else onto this question? If not, oh, yep, go ahead, Dr. Sharon.
Add one thing.
Yeah.
As for another thing that SILs can do, I know we provide really good medical healthcare for our staff, because that's the philosophy. In doing that, we should also ensure that there's good mental health coverage for those that want to seek services. We should also tell our staff about the differences between what a master's level clinician can do versus a doctoral level and also an MD level clinician practitioner. We should also encourage our staff to use their time off. Working in an independent living center, working with other people is also taxing. It's a lot of energy. So we give a lot of good PTO time off, and people should take that time to take care of themselves so that they can be able to take care of our consumers. We should also have celebrations, okay? Like May is Mental Health Awareness Month. And we should, just like we celebrate October as National Disability Employment Awareness, we should celebrate mental health as well, so that people feel comfortable about, oh yeah, this is something that the organization supports, and we're advocating for every aspect of disability to be celebrated. I'm sorry. And the last thing I'm going to say is that you should also set up your offices as a way of engaging folks, meaning the types of posters that you have, literature that you have. You have to make sure that things are inclusive, just like we look at race-based literature, arts. We can also talk about having literature about mental health, and also advertising. We also, in our signature lines, we put in the crisis, 988 is nationwide now, which is a hotline for people that are in crisis. So those things can help everybody. Thank you.
Dr. Sharon, you are speaking my language 100%. I mean, I can even just say here at Nickel, we use sick time for mental health leave sometimes, because it's something that we encourage: personal time, sick time, anything like that. And I also really love the idea of celebrating mental health in May, but throughout the year too. I think that personally, mental health is so important for everybody, and creating that good culture in yourself really allows your entire staff to help everyone else better too. So now we're going to move on to the next question about values alignment. So I'm going to start this one off with Jesse. If you could kind of come on screen. And I'm going to ask you this question, Jesse. What values or guiding principles in your CIL align with a culture supportive of the mental health and well-being of your staff and consumers?
Well, this is a phenomenal seminar, and I just, my colleagues, I just echo just the goodness of all the great ideas that are going on here. I came also from 17 years as a president of a behavioral health firm, a licensed mental health and chemical health clinic. When we think about values and the guiding principles, I think about notably, look, we've just come out of 3 years nationwide of a severe pandemic. We're nationally in a mental health crisis. And when we think about our centers for independent living, I'm happy to share with you that from Metropolitan Center for Independent Living, our #1 guiding principle is the word mindfulness. And mindfulness to us recognizes a number of things: the universality of the human condition, the inalienable rights of all people for life, liberty, and happiness. And yet, at the same time, this also recognizes human dignity. Human dignity is, recognized that human dignity is endowed amongst all people throughout the world. That means each and every person throughout all time as well. So these are the values that guide us. And we think about our staff, the people we support, and the people who receive services from us, whether they're apparent disabilities or non-apparent disabilities, whether physical disabilities, sensory disabilities, mental health, diagnoses. What's important that we recognize is the human journey, that sense of intrinsic motivation that people have. And so I wanted to mention that one of the questions we asked throughout the pandemic is, how are people faring? Whether our staff or the people we assist, and it led to some really great breakthroughs. At MCIL, we have independent surveys of our employees. And so along the way, we learned about when there are support systems for families that were not in place, what did that mean to our employees? How could we help deepen support for our employees? I was happy that we have the NICE program to provide mental health support and other related services to our employees. I also want to mention, when we think about our staff, one of the trainings that when I came to this center, we conducted is on vicarious trauma, or what's called secondary trauma. What that means is that as our employees and as we as centers are assisting people who are overcoming great barriers, who are dealing with issues that are, life and death and painful and difficult, how does that impact our employees? And what can we do to really create that, what I call that emotional breathing space, so that we're supportive of people in the time that they need and being able to take care of self. So in this regard, in addition to supporting people with physical disabilities, mental health disabilities, sensory disabilities, we also want to think about creating an environment that just the nature of the work itself can impact the well-being of all employees. And this is why things like training sessions on vicarious trauma are critically important, so that we can gift our employees with what are the indicators of how stress can impact well-being, what are the indicators of how when people need to seek support, and what can we do within leadership to nurture that sense of journeying with people, and so that we're really listening to not only what people are saying, but how our employees feel. These are some of the guiding principles that we're super excited about at MCIL, to nurture that sense of well-being, that sense of those inalienable rights, and that sense of human dignity, so that people can find a space to contribute. Ultimately, for us, and I believe it is possible, we want to create an environment for our employees to find meaning and joy in the work that they do. And, that is something that's really important to us, and that creates an illumination. And so supporting our employees to be okay, to take care of self, to nurture self-care, these are the things that are really important for us. And Jenny, I'll toss it to you in case you'd like to, respond to those ideas or any thoughts about that too. Thank you for allowing me to answer this question.
Oh, absolutely. And I know you're also on our next question, and I think that you're gonna elaborate a little bit on what you just kind of spoke about. So I'm excited to hear that as well. I think that it's very true that, especially when you take care to make your employees feel appreciated and valued, it really results in productivity, but also enjoyment. And it really kind of translates all the way down to consumers, and all the way up and all the way all around kind of thing. So thank you, Jesse. I'm going to throw it over to Sarah. Yeah, Sarah now. Sarah, can you give me a little bit of your thoughts on this?
Sure. Values and guiding principles. Yeah, I think that for me, I really do think about it. I'm going to go from a, people who have mental health issues sort of perspective. I think that understanding biases is really important. Understanding where people are coming from and not judging. I remember when I started at our center, I was walking down the hall and someone was on the phone, and they were on the phone with somebody who was, really excited, really upset, and had a psychiatric disability, and they hung up the phone. They're like, I hate people with mental, I think they said something else, but psychiatric disabilities. And I was like, whoa. And I'm like, I'm working in this environment. I have this diagnosis. I've been through these systems, and like all of a sudden somebody who I admire is saying this. And so understanding where someone's coming from, because if I flip that and try to understand where she was coming from, I could sort of start to see and sort of unravel like how we're all connected, how we're all working towards that same vision, and then we can learn from one another. I think having good choice, having right to fail, having solid information so that we can understand what choices that we might want to make as individuals with disabilities. Freedom is really important, especially for those of us who have been locked up for long periods of time, and understanding how we can gain that freedom. Peer connection is a guiding principle that has saved my life more than once. And then accessibility, like hearing from individuals in the deaf community that they can't access an AA meeting, for example, because there's no interpreter being paid for, or other accessibility issues like that. And then I guess finally, like what was talked about before, like having that good solid training so that people aren't overreacting and calling the police on folks when they come to your center, and not making any of those value judgments, and making sure that people really understand how we can all work together. So I think that's all. I'll stop there.
I think that was extremely insightful and valuable content, Sarah. Thank you for that. Does anybody else want to add anything onto this topic? Great. Love it. Let's keep it moving, people. Okay. So next up, we're going to discuss a little bit about evaluating staff and consumer feedback. So I'm going to invite Jesse back again. And Jesse, I'm going to have you give a couple examples of how your CIL engages with staff and consumers to assess, understand, determine I can't speak today, don't mind me, I need more coffee. If it is doing well and where it needs to improve with supporting the mental health and well-being of its staff and consumers.
Thank you for the question. And I really appreciate what Sarah just mentioned. And I want to carry that through, because what I feel in listening to Sarah is that we recognize the humanity of each person, that the human person matters, that we get beyond stigma and labels and value the sense of what I call welcome and belonging. And again, I want to give a real important example. I'm super grateful to our Director of Human Resources, who the last 3 years have interviewed each and every one of our employees. We're a fairly medium-sized, maybe a bit larger agency. And so one of the reasons why she has done that is during the pandemic, when so many of our employees are remotely deployed, she's checking in with, how are you doing? How is it going? What can we do to be there for you and with you? We also looked at, on an annual basis, employee surveys, and we designed the surveys. We were working with a national group, and they came with a cookie cutter example. And we said, no, we don't want to know that. We want to know questions like, how are you feeling? What's going on? What do you need support? How's that work-life balance at home going? And from that, we discovered things such as 54% of our employees were dealing with issues simply of not being able to get their needs met in the home environment. And so how does that translate out in terms of our employees trying to, live that life of balance in the work-home life balance? So that led us to some insights. We quickly realized that what could we do to find added supports, as Sharon was mentioning, and making certain that we are training and nurturing an environment that really is supportive. The other part of this too is that we also, as a Center for Independent Living, want to make certain that we are connecting with the provider community in mental health and thinking about, I should say that there are over 92 languages spoken in the city of St. Paul, which we're headquartered in. So interpretive services, so that we're thinking about language appropriately, culturally competent services for folks, and making certain that we're making those connections, and that having come personally working as in a behavioral health environment is to nurture that sense of connectivity. who are the providers, who are the sense of the care networks that we can make certain that we're connecting with to assure that we are providing the kind of supports as we're working with people to make certain that for our consumers that we're making that connection. We provide CADI waiver services as well. So, many of our consumers are persons who are on waivers programs with, the intersectionality of, physical and, invisible or non-apparent disabilities. And even in that training, we always come back to this point of human dignity, of recognizing that people matter. And that, I think, is the most important part of the sense of that journey that creates the sense of welcome, that sense of belonging, and that what I would call that emotional breathing space for people to have that sense of self-care, and as well as our workers to help nurture that sense of care in the people that we're working with as well. So those are some examples that for us really made a big difference of navigating through this once in a generation timeframe that we're coming away from. And I mentioned the pandemic, not in a traumatizing way, quite the contrary, that we have to recognize we are still moving through that pandemic. We are still moving through with our employees who have been there every step of the way and assisting every person that we've been helping. Yet at the same time, we do know that in order to nurture an environment of mindfulness, we need to continue to create that space that our employees know that they matter and that we are deeply committed to their well-being, in addition to the well-being of our consumers as well. Jenny, I'll toss it back to you.
Yeah, that was very well put, Jesse.
Thank you.
And that's, I got nothing but other than that was very well put. So thank you on that. And I'm going to have Anne come on and just give any thoughts that you might have.
Yeah, I wanted to kind of expand on that piece of nurturing our employees and giving space to these kinds of conversations. So it's really important to, there's this saying that we use in when I'm being a therapist. So we have to put our oxygen mask on before we can help our consumers or our clients or patients. And it's the same for any employee, especially if we're client facing and we're talking to people who are having really difficult times in their lives. So it's important to have that space and foster the emotional well-being of employees in order to be able to have that not trickle down to our consumers. Another saying we use is you have the responsibility to be more well than the people you're serving. If we're helping individuals who are having a harder time, then we need to be in a place where we can give them a little bit more of that emotional self from us. And I'll leave you with one last analogy. I love analogies in therapy. So in the beginning of the day, say every time we wake up, we're given a certain amount of spoons. And throughout the day, we give out our spoons so everyone else is able to eat their soup. And at the end of the day, we get home and we realize that we look in our pockets and there's not a single spoon left for us, and we have nothing to eat our soup with. And this is the analogy to look at what we have in our emotional reservoir. So if we are not caring for ourselves as workers, employees, caretakers, then we don't have anything to give others. So focusing on us, and then we can focus on others.
Love it. And I'm totally going to quote you on that. So just letting you know ahead of time. Anybody else want to add anything to this? Jesse, go for it.
Yeah, I really do. I really like what Anne's talking about here. And you really, for organizational life, they have said that 85% of the psychological well-being of an organization is due to the top leadership. And what's really important for leaders is this nurturing of an understanding of why emotions matter. They don't teach that in the MBA schools. I've often taught in the MBA schools about productivity is really a direct link to that social emotional intelligence. I really like what Anne said, and I just wanted to elevate self-care, self-awareness, leadership that creates a space for people to find joy and meaning in life is so critically important. Years ago, I trained with a fellow named Edwards Deming, who helped rebuild Japan after World War II. I was a young business consultant, and he helped he helped solve U.S. auto crisis by, he had this quality improvement movement worldwide. He believed two things: that all of us are intrinsically motivated and we want to find meaning and joy in what we do. And number two, he said, drive fear out of the workplace. And I think the way we can do that is nurturing the goodness of who we are and making a difference in the lives, not only the consumers that we assist, but really creating that very special optimized environment where people are, it's TGIM because they're super excited about making the difference in the lives of people. But it really does, I want to really echo and appreciate what Anna's saying. It really is about self-care and self-awareness and leaders that nurture that support for others as well. Thank you.
Thank you, Jesse. Sarah, you want to pop in?
Sure, this is Sarah. I also don't want to underestimate the power of our policies. And I think that bringing staff and bringing folks to the table around our policies and really looking through that lens of, are we really supporting people? Years ago at our center, we ended up creating a staff rep position that sits at the board of directors. It can switch from person to person. They don't have a voting right, but they can bring directly issues and concerns to the board. And it allows for these, really rich potential conversations around certain things like that. And then I think about like, how do we look at that leave time? I lost my husband a few years ago, and all of a sudden I'm faced with a bereavement time of 3 to 5 days. How do we start to have conversations around what does this really look like overall around everything? And I think of this pandemic, like from our perspective, we are thick in a pandemic right now, and the surge is happening and nobody seems to care anymore, right? And our people are dying, our people are not getting the supports that they need at all different levels. And so how are we making sure of that? Along with, in Vermont, we just lost our entire center. So we're kind of displaced from this flooding. And so really checking in with staff, checking in with folks across the board, calling all of the peers that we work with just to make sure, hey, where are you at? And really assessing it's super important to continue to do that work on a regular basis. Thanks.
Thank you so much, Sarah. Really good insight there. So before we continue on to the next question, I just want to use my pun for the day. I don't even know if it's a pun, but speaking of evaluating, make sure that you fill out the evaluation. We have it linked in the chat box and in both Spanish and English. So feel free to take a couple seconds, pop on, fill it out. You love us, you hate us, you want more, you want less, put it in there. Okay, moving on. That was my one plug. Oh, Dr. Sharon, sorry. Oh my gosh, I totally didn't see you down there. Hold on. There you go. Okay, you're up.
Thank you so much. I just want to, I think everything the panelists said is excellent. I just want to add one thing that we may want to consider as we were in this pandemic. For a lot of our staff, the hybrid approach. People are just so worried about coming back to the office 5 days a week. And it's really important as the executive director and also working with the board for them to understand that for those individuals that are very effective in working from home, part of the time, they should do that. As long as our contracts are still serving our consumers, we're still getting things done, we should do that. And also, we should take into consideration that for people with disabilities, a lot of the times in getting to, any type of employment was the barrier of transportation. And one of the things that the pandemic has shown us is that for those people that are able to work from home, they're doing it and they're doing it effectively. I'm not saying working from home is for everybody. For some people with disabilities, it's really good. So trying to work in that hybrid model as one of your policies, if you're able to do it as a CIL director, we should do that. Thank you.
Thank you, Dr. Sharon, and cheers to that. And I'm sorry, so sorry again that I missed your hand raised. So thank you to Joey for mentioning that to us. Okay, so we're gonna move on to our next question. And this question, I'm gonna start out with, actually, let's start out with Dr. Sharon, you wanna come back on real quick? And we'll start out with you for this one. So this question is on diversity, equity, and inclusion beyond compliance. How does your CIL support diversity, equity, and inclusion as more than just a strategy to comply with legal requirements, specifically when it comes to supporting the mental health and well-being of your staff and consumers?
Well, we're in New York City. So our CIL represents the people that live in New York City throughout the 5 boroughs. We have 70% of our staff are from racial minority backgrounds, ethnic minority backgrounds. We speak 20 different languages as well as American Sign Language. People live throughout the 5 boroughs. It's not like people just because they're Manhattan, they're not from Manhattan, they're from Bronx, Queens, Staten Island, Brooklyn, all over. I think our staff represents our community that we serve. They have disabilities like our consumers. They live and breathe the life of New York City. They understand the barriers that are presented for being a person of color, being a woman, being a man, being transgendered, whatever it may be. So having a CIL that represents the population that you serve is important. The Administration of Community Living survey shows that Bronx County is the highest county of people with disabilities in New York State. So of course, we have a lot of staff that lives in Bronx County, but we're also working heavily with that borough, because that's where our consumers are from, and they're from all 5 boroughs. I think it's important to understand your consumers, understand the needs, and make sure that your staff can identify with the consumer, maybe by language, customs, food, disability, accommodations, whatever it is. I think as a CIL, the philosophy has been a peer model. I have it, you have it, we have it together, so to speak, right? So in keeping with the philosophy, hiring the staff that represents your consumer base is critical. Thank you.
Yes. Thank you, Dr. Sharon. So I'm going to invite Jesse up next, because I know, Jesse, you had mentioned that you have so many languages spoken in Minneapolis, St. Paul area. And I can you elaborate a little bit on how your CIL supports DEI?
Absolutely. We see diversity, equity, inclusion, accessibility, and belonging is the curriculum that we're developing at MCIL. Over 60% of all of the people we assist are from racial and ethnic backgrounds. We've also a very high percentage of our employees are from racial and ethnic communities. We look at diversity, that term, and we recognize the importance of race and ethnicity. And at the same time, we also include vibrantly all protected classes. In Minnesota, I'm so happy to share with you, we're celebrating this year on December 10th, the 40th anniversary of Minnesota Human Rights Day. I'm just happy to share with you, it was my mom, when she was the Commissioner of Human Rights for the state of Minnesota, that instituted that. And as my mom would say, we're one race, the human race. And yet it is through the richness of mosaic of who each of us are, made up of language and culture and food and community, and with the rich array of people we assist and with our employees, we look at, again, from language, we look at from race, from orientation, from gender and religion, the richness of the human experience. And how do you nurture this environment that says welcome and belonging? And for us, it comes back to, yes, independent living. It does come back to the journey, and each and every person is unique and awesome. It comes back to the idea of the universality of how people find in their own life journey, or that of their families, however they define families, of what the pursuit of life, liberty, and happiness means. And we also recognize that this is also about human dignity. And so for us, looking at diversity, equity, inclusion, accessibility, and belonging really means, how do we look at, perhaps an in-service on a particular aspect of mental health diagnoses and understanding what does that mean in terms of how we support our employees with perhaps a persistent and chronic and severe mental health diagnoses. How do we help nurture an environment where this individual can be absolutely at their best and knowing that they are well supported? That's the kind of work I think is really required for us as a Center for Independent Living. It also means for us constantly listening and customizing what we do and always thinking about nurturing that sense of continual engagement with our employees. We see innovation as kind of turning the agency upside down. People closest to the point of service have the most insight, and it really has led us to breakthroughs in terms of how we think about efforts. We're about to launch an effort that will be focusing in on, not to go off point, but on the direct care workforce shortage crisis. We would have never got to that space if it wasn't listening to our employees, notably during the pandemic. So listening, I think, is really important, not only what people say, but how they feel. And that's a really critical aspect. It's listening in that fourth dimension through language, through culture, through life experience, and the richness of what that means ultimately of recognizing the universality of the human journey in each and every one of us. And that's a pretty awesome opportunity. Jenny, I'll toss it back to you. Thanks.
Thank you, Jesse. Sarah, and you guys want to add anything in? Anybody else want to add anything into this? I think this is great conversation so far, and I'm quite enjoying it. Yeah, go ahead, Sarah.
Yeah, I'm not going to say this eloquently. I think, our experiences in Vermont, are maybe a little different, right? We're incredibly white state. And I think that when we talk about things, we had to really expand in our community to really start having the conversations about the differences, right? Around racism, around homophobia, transphobia. And it's seeped deeply, not only within our state, but within our independent living movement, within our disability movement. And so having those tough conversations and really starting to move in stronger connection. We've spent a lot of time, in human rights, also connections, community, but really starting to listen and understanding within our community where we need to do better and doing better. So a lot of work, we have a health equity commission. It's really important to us right now. And looking at, where are we? Where is the data around inclusion and equity around health and where do we need to do better as a community? And then having those conversations inward and then outward and really advocating, going outside the box, that it's not only about disability and ableism, and that it's stronger and we really need to mesh that all together.
I thought that was said quite eloquently. So I think you're pretty good there, Sarah, but yes, still fully agree with everything that has been said. So we're going to keep the conversation moving because we do have a couple questions building up here. Our next question is on establishing trust. And I am going to invite, let's have Anne come on. And Anne, if you just want to answer the question about trust is essential to creating a CIL culture where staff and consumers feel psychologically safe. What concrete action steps can CIL leadership take to cultivate trust within their organization? How has establishing this trust played a key role in supporting your staff and your colleagues' mental health and well-being?
Well, when talking about mental health, oftentimes it is a sensitive topic because it has been so marginalized for so long that people don't often feel very comfortable just coming out with their mental health difficulties straight out. So establishing that foundation of trust is extremely important, especially with employees who may need to come to you for more support in a time or may need to ask for different accommodations if something mental health wise is coming up. So establishing this level of trust is really important with open communication. So not hiding certain things about mental health, allowing these conversations to happen and creating space for these conversations to happen, even if it didn't even come up yet. Just having that as baseline, as there is space for this. Transparency and like making sure that employees know what they need to do and who to go to when those conversations need to happen. Oftentimes it's really difficult to set boundaries with employees when you know that they're struggling with their mental health, but it is really important for that trust to establish those boundaries, because without boundaries, there's not trust. And those two things really are interconnected, because if we're having no boundaries and somebody is continuing to push them, that person doesn't know that they're pushing the boundaries. So establishing a firm and gentle boundary is really important, to be like, this is the criteria that we have to abide by. And, you know, I understand that you're experiencing these emotions and all of that. So a welcoming, warm environment can be very beneficial for that. And in building that trust, open body language is really important, open communication, very concise and important words, and understanding that, making sure that the other person does understand what you're talking about. So that's basically the foundation that I wanted to talk about in that. So thank you. I'll send it back to Jenny.
Thank you, Anne. Sarah, I want to, or Jesse. Yeah, Jesse, go for it. Yeah, go ahead. And then we'll have Sarah on kind of conversation style.
Just really some key things. Essential job duties on job descriptions are reviewed all the time. Work performance reviews are conducted 100% all the time. When I came to MCL, I instituted that we have anti-harassment training from independent provider, separating leaders from workers or people who are providers, so that people have their own space. Our expectation is 100% of our people, including me, go to these training sessions every year. So creating this environment, and then having a really strong, well-written employee handbook that's reviewed all the time. You know, we take our employee handbook very seriously. Past practice supersedes policy. So we're very careful about how do we nurture the constancy, consistency, and cogency of a really well understood, internalized employee handbook, notably from leaders, because that's where the trust is with employees, is nurturing trust in all that we do in alignment with those policies, and making certain that we're adding value to be of service to our employees as well. I'll toss it over to Sarah, but I wanted to also mention these are some really vital elements for us of where we've nurtured and really want to continue to build on that trust. Thank you.
Hey, this is Sarah. I might have a differing opinion a little bit than Jesse on some of that. I agree around consistency and boundaries, and I think sometimes it's used against employees. I was fired, you know, for people finding out my diagnosis. I think people use policies like dress code and that sort of thing to really strip down and not, you know, allow people to be themselves. So I think being really careful about how much we put into policy is important as well, and having that balance. I think the right to fail is really, really important. And it's part of our overarching, you know, who we are and who we are in leadership. I am the first to tell you and openly admit every misstep that I make along the way. And I think that being vulnerable is really important, and sharing those experiences. Like, I broke the 3-hole punch my first day of work, and I didn't get fired for that, right? Like, people brought me in and taught me how to use it, not stuff 40 pieces of paper in it. So those missteps are those opportunities, and leadership can be really instrumental in making sure that people feel safe and have that. I also think, like, openness about your budget, openness about who you are as an organization, really having dialogue around those policies so that there is true understanding overall, having that strong communication that folks were talking about, and just also understanding that not everybody is coming from that same place. So I might want to be open about the budget, but like the person on the other side might not care at all about that. So, like, trying to kind of have that back and forth and making sure that we're listening to what is good, and then implementing from there. And then a long time ago, I learned about what's called a stay interview. So a lot of people put emphasis on exit interviews as somebody is leaving your organization, but I learned about these stay interviews where you invite employees to the table and have conversations. Why do you stay at the center? What brings you joy in your life every day coming to this work or not? And what can we do to improve? You know, if there was, you know, $500,000 that came into the organization, how would you spend it? What would you want to see our focus and vision really go to? So, like, trying to build that. And I think over time, with that consistency that Jesse was talking about, you're going to have that trust within the organization.
Yeah, go ahead, Dr. Sharon. I agree with all the executive directors. I'm just going to add a couple more things. Because I know here at Sydney, we have almost 100 employees. So having that in funding can also allow you to do more things. So we have to take that into consideration, that some CILs are smaller and they may not have the ability to do some of the things that were suggested. But one day you'll get there. One thing that I've seen here at Sydney is that having a separate HR department. I know there are some executive directors that try to have multiple hats, and it's really hard to navigate one's privacy as the executive director if you're doing HR. So is anyone that's listening to me and you have, the one thing you want to ask your board for is try to get funding for director of HR, because that's how you really establish trust and having things be separate. Your staff should come to you for information regarding what the actual deliverable is for our consumers. Their personal needs and wants, you're going to try to execute that as much as you can through funding. But the HR director is going to ensure that he or she gets what they need through time off, through medical leave, through policies and procedures, through when someone dies, life insurance, all those things that can happen with employees. You need that person to kind of navigate that system. Your HR person is also going to advise you on all the compliance stuff, but more importantly too, to advocate for those benefits that we may not be able to have right now, that we want to keep on our radar for the future, like long-term care. A lot of our organizations don't provide that because it's very expensive, but that is a goal. A retirement package is a goal, okay? The last thing I would say for any CIL or any CIL director that is, 3 to 5 years into the organization, strategic planning, start to do that. Work with your board. Sydney, we're doing that right now. On strategic planning, that will give you an opportunity to invite your staff to be part of that strategic plan. When people think about the next 5 to 10 years of an organization, and they hear about what you're planning and what you want to do, they get excited because they can see themselves, well, if we get that program, we get that money, okay, maybe I can be able to advance myself. Maybe I'll become a director. Maybe I'll become a manager, whatever the case may be, whatever that goal for them is. And also as supervisors, you need to mentor your staff so that they have an opportunity to learn those salient skills so that they can advance themselves. I don't see any person, unless they really, really love it, they want to stay in the one role for the rest of their lives. Okay, if that person is like that, that's fine. But most of the people would like to see themselves advance, move up in the organization, make more money, do more things, acquire new skills. So provide the path to success, the path to advancement. Those are my thoughts. Thank you so much.
Thank you so much, Dr. Sharon. And I think my favorite part of this question is hearing the different perspectives from 3 different CILs who have, 3 different numbers of staff and who have 3 different funding levels and who have 3 different cultures. And it's just so interesting to hear the difference and the different thoughts and opinions of what is working at your center and maybe what people who are listening in can take home with them. So we're going to keep this moving on a little bit. I believe we have one more question. And so before we get to the audience Q&A, so I'm going to invite, I'll open this up to whoever sort of wants to answer this question first. But this question is about how CIL culture impacts consumers. What are some examples of innovative policies and practices implemented at your CIL that have played a key role in cultivating a culture that meaningfully supports your staff's mental health and well-being? And then how has this culture informed the successful transition of consumers with mental health disabilities? So a little bit of a double-pronged question. And if nobody comes on, I'm going to call on someone. So come join me if you want to answer it.
Okay.
Hey, Sarah.
This is the problem of being an extrovert. I don't actually have the right answer. So I'll start us off.
That is okay. It is what works for your CIL. It's not necessarily right or wrong. It's the way that you are able to do this with your CIL.
I think for us, it really comes down to peer support, right? So like in so many other states like ours, we've had these conversations around peer support and to the level of peer certification. And we developed this wellness workforce coalition years and years ago, where people from all different parts of mental health came together to talk about peer support and how we really wanted to run that and make that look. And we had, folks from one extreme that really wanted to see a more formalized certification process. And you have people like me who want to stay old school and not have a certification process. And I think the importance part is the culture of conversation and the culture of coming together to make sure that we're all really trying to figure out what's really the best move within our region, within our state. I think of how that translates. One example that I like to give a lot is a peer support worker who there was a person that was in the emergency room, has a mental health diagnosis, and police are called in, security, everything. Peer support worker goes into the emergency room and says, and it was allowed at the time, I'd like to take them out. Said to the person, have you eaten? No. Went out and got an Egg McMuffin for them, gave them an Egg McMuffin. All of a sudden their entire world changed. And, Anne talked about this in the beginning, that sometimes it's just about the Egg McMuffin, right? Sometimes it's not about that this person is quote crazy or this person's going to get locked up. We just need to really take care through peer-to-peer support and allow for that transition to happen. So that's really powerful to me, and how that culture kind of follows. The other thing that we do is we take a lot of care in what money we accept. And so that allows us to really pivot on advocacy issues when we feel like people are doing harm to our community. Years and years ago, I don't know if anybody on the call was at this conference with us. I went to a HUD conference and we took it over because we felt like they were being discriminated against us with disabilities. And we took it over. We grabbed the microphones, we demonstrated, did a whole thing against HUD. And we got some wins through that. But also through that next year, all but one of our centers for independent living were not funded by HUD anymore. And so these moments, these decisions that you make around advocacy are super, super important in how you decide to move forward. And I think that having a culture where you come in, you evaluate, is this the right grant for us? Is this how we're going to move forward? Or do I have more power as a center to be able to not accept that money? And it's hard because we chug along, right, in terms of how much money we have. But we're able to pivot and do what peers in the community are asking us to do, which is fight for our rights. Thanks.
You gave me chills on that one, Sarah. I thought that was pretty good, pretty well said, especially the Egg McMuffin part. I really actually found that quite interesting and helpful. Anybody else want to chime in on this question? Jesse, all you.
Yeah, I will a little bit. When I rather go back and read the question, innovative policies practice that our CIL has played a key role in cultivating culture and meaningfully supports assessment health. Again, my background was a chief strategy officer for a university. So having written a lot of strategic plans, the first question I got to MCI was, tell me about values, tell me about what matters. And interestingly enough, the word mindfulness really came to us from our employees. And what we see is the richness and the universality of welcome for all people with disabilities. So for us, that has the sense of equity of welcome, whether for people with apparent or non-apparent disabilities. For our employees, this sense of mindfulness means for employees who are dealing with mental health diagnoses, I want to pick up on what Sharon said about a really vibrant human resource director. We have an incredible director of HR. And so creating that space with our HR director that people are comfortable, people are welcome, people can talk about those issues that they have and figuring out how do we help support people. To me, that's culture. The stay interviews that Sarah had mentioned, that's what we do too. That to me, I think is culture, so that our people have a sense of well-being in working with all people with disabilities. To me, that's the culture and that's the welcome. And that, there are times that even myself are part of a team to say, how do we triage and make certain that we can get, that client what they need and working directly with us. We have really strong directors who oversee all of our divisions, and that's the role that they play too. But I really want to echo this notion that what are those values that you can identify, because values are time honored and they live in organizational life. And if you can bring out those illuminating values like mindfulness, my goodness, what a difference it makes in the lives of our employees. And they bring that sense of enthusiasm and inspiration and welcome in support of all people who come to us as a Center for Independent Living. Thank you so much.
Thank you, Jesse. Dr. Sharon, go ahead.
So everyone here has stated regarding the staff side. I just want to add something regarding the consumer side, which will really help and impress the staff side. So right about the beginning of the pandemic, Sydney acquired some funding and they decided to do a reassurance wellness program where we call our consumers to check in with them to see how they're doing, especially through the pandemic. When I came on in 2021, I was able to find more funding to continue that program, because the idea of our consumers who were suffering from social isolation, not having anyone care for them, losing family members during COVID, and knowing that someone from Sydney was going to call them to say hello was tremendous. And I think once the staff learned about that program, it gave them hope too, to know that someone cares. You know, someone is going to call you if you're in time of need. Maybe they have parents, maybe they have other friends that have disabilities, and they would want them to become Sydney consumers so that they can get a wellness score. It's a powerful thing. So for CILs that haven't tried that, looking for funding to do that, I encourage you to do that, because a lot of the times our consumers are isolated, and especially through the pandemic, they could not get out, they could not have engagement, that face-to-face engagement. But knowing that someone's going to call them every week or every other week, depending on the flexibility of the schedule, the availability of counselors, is great. And they're not their therapists. So I just want to say that they're not the therapists. They are just a reassurance person calling to check in with them, see how you're doing. Are you okay? Did you eat today? Do you need your meals? How's your food stamps? Did you lose any benefits? Do you still have medical coverage? Whatever it may be, or just to say, hi, I'm thinking of you. It's a difference. And I think that also can transcend through the staff, knowing that where they work, we care about people. And I think that's a good thing. Thank you.
Go for it, Ann.
Just wanted to add on Dr. Sharon's point. I was speaking to one of our reassurance counselors this morning, and they had gotten lovely feedback from one of our consumers. And one of our employees, the reassurance counselor, said something along the lines of, I didn't realize how much of an impact we make in doing our jobs. And getting this call from this consumer, telling me how much they appreciated me calling them every other week or once a month or whatever it was that they had this contact with our employee, changed their life and brought them to a point where they could get housing, food stamps, a job, and being able to then be that person in society that they wanted to be. And hearing these success stories is what really keeps our employees going. The smile on the reassurance counselor's face this morning when we talked was from ear to ear. It's really impactful just to know that we're making a difference as well. It really helps with our mental health.
Love it. Any other thoughts on this, final thoughts on this? And if not, we will continue on to our audience Q&A. We have about 12 minutes left, so this time has flown by. So before we get started on our audience Q&A, I just want to remind people that we do have an evaluation link that is posted in the chat. Please go fill it out. Don't assume someone else will for you. Go fill it out. Takes very brief amount of time, but really means a lot to us and helps us continue to improve on these webinars and continue to bring you content that you want. So next, we're going to go on to our Q&A section. Dr. Sharon, I might call you up for this question, as you kind of just touched on it a little bit. But Ashley asks, are there ways to find funding to provide mental health counseling at a CIL? such as grants, etc. Do you have any recommendations?
Yes. So I'm hoping that all the governors across the United States has realized that the pandemic has caused for a great need for mental health services. Our governor, Kathy Hochul, has done that and has made it one of her priorities. So on your state, I'm sure everyone has a state database that provides grant funding. You could check there for your particular state. There's a lot of money coming out of most states right now for mental health. As from early intervention, going through elementary, high school, college, as well as community-based organizations. So I would start there. In addition to, of course, the federal government, grant.gov, there's things there for mental health as well. Just take the time to look. If not, every state has private foundations, and private foundations realize that the need for mental health services is incredible. So take a chance. Pick a family-based foundation, maybe something popular like Bloomberg Foundation or something, Michael Gates, and try to apply for setting up an initial program. You won't know it until you try it. Thank you.
Thank you, Dr. Sharon. Anyone else want to chime in on that question for us? Jesse, go ahead.
Yeah, I do. Having served as a president of a behavioral health firm, I'd also encourage, if people are interested in mental health, to look at the licensing within the state. You want to look at, are you prepared for clinical system design? Are you looking at everything from HIPAA compliance to databases to, clinical therapists? And then also, if you are looking at mental health services, to what extent what's the breadth and scope of those services that you want to look at? I would say, given the often for, like in the state of Minnesota, the licensing requirements, it really would start also, in addition to those great ideas that Sharon has mentioned, is to look at licensing so that you can start to assess what will it take to prepare to become a provider of mental health services. Certainly you don't have to become, possibly, I'm not an attorney on this, some places you may require to be licensed as facilities. So looking at your state human services, what are the licensure requires to provide mental health services in the state of Minnesota? It's a Rule 29 provider, making certain you're preparing for that kind of opportunity as well. Thank you.
Very good suggestion. Thank you, Jesse. Go ahead, Sarah.
And I think in terms of the money that, Dr. Sharon really laid it out, right. But I would also just add things that maybe some centers might be more of a fit with, instead of going to the level of mental health counseling and that sort of thing. Maybe you connect and get training on the WRAP, like wellness recovery action plans, where you really can connect in peer-to-peer support and mental health specifically, or intentional peer support is an incredible training program, or connecting with the Hearing Voices network. So like trying to find where your center really fits overall within this whole entire, myriad of stuff.
Yeah, absolutely. I think it is very much, all centers are very different from one another. And so while we have the same kind of core principles, it's very, very varied. Sorry, that's really bad. When it comes to what your center can use and what your center might need for this. So we're going to move on to the next question. And this question is, how do you advocate for change in your CIL work environment and culture if you're from a minority and have the feeling that you will not be heard nor acknowledged? It's a little bit more challenging question. So I'm going to let anyone pop in who feels like they can answer that. And I will repeat the question again. So it's just, how do you advocate for change in your CIL work environment if you're from the minority and have a feeling that you won't be heard or acknowledged? Anyone want to take a stab at that question? Go ahead, Jesse.
I will. Gosh, I feel empathy and anguish in just hearing the question. Everybody matters. I hear a person who says they love what they do, they have pride in their work, to me, the question is, why would we not listen to what the person has to say? You know, from our worldview, the universality of the human condition means all are welcome, all have a role to play. That to me is it's at the fabric of who I am in terms of my constitution. Nurturing upward ideas, working with colleagues, working with, you know, some leaders at the organization that would create this sense of connection can be helpful. But I can share with you as a chief executive officer, it is critical to the well-being of a center that we listen to what people have to say and that we welcome how they feel about those ideas. It's at the core of the vibrancy of who I am. And I feel a little bit of anguish from what I heard the question, but to that person, hang in there, you know, find allies, find opportunities. And I recall when I worked in larger institutions, the kind of acumen I had to develop in creating what I would call a sphere of influence and expanding that sphere of influence from the standpoint of a diplomatic perspective. But to you as an individual, you matter. Thank you for asking the question. And it sounds like you've got some ideas that your center can really benefit from. And I would encourage you to find ways to share that, because your voice matters a lot. And I hope that, if anything, I'm giving you some hope to continue to hang in there and offer those ideas, because they do matter to the centers greatly. Thank you.
Love it. And does anybody have any other content on that? If not, I'll move on and bring Jesse back on to the stage to ask the next question. We've had a couple of these questions, Jesse. People are interested in potentially getting a copy or seeing a few questions, examples from your employee survey that you mentioned.
Yep, absolutely.
So maybe what we can do on that is, if you want to send it over to me, we can send it out to the registrants. Or if someone specifically wants it, feel free to reach out to Jesse.
You know, the other thing I will send out, it's a diagram on what's called a strategic human resource plan. Every institution that I've gone to build an institution to create optimization, a strategic human resource plan will give you the scope of work where we nurture trust, where we nurture recruitment, retention, succession planning, but most importantly, optimization of contribution of what each and every person can bring to that Center for Independent Living. I'll send out an overview of what those, you know, the big boxes are for that, but I'll talk to our Director of Human Resources of what the survey questions were. They were designed specifically for our centers. We worked with the national organization. We looked at their questions. We threw them away. We said, no, this is what we're going to ask, because our people matter to us. And so it'd be my great honor to send you those questions, and Jenny will send those over to you as well.
Yeah, absolutely. We actually had a couple of questions requesting that.
Got it.
So definitely something that people are finding interesting. So I think we have time for one more question. And I think that this is an interesting question. I'm not sure how or if we're going to be able to answer it, because we aren't necessarily, this isn't necessarily specifically, but maybe someone can answer. How should we address the mental health issues of employees when their performance is greatly affected? A little more challenging. I'm not sure if anybody wants to try to tackle that. Go ahead, Sarah.
Oh,
We'll start with Sarah and then we'll switch down to Jesse.
Okay, either way is fine with me.
Yeah, go ahead.
I think it really comes down to accommodations, asking, you know, what accommodations need to be made, but also on the flip side that if people aren't performing and people aren't doing their jobs, that we do have a responsibility as organizations to move forward with discipline or termination, right? But you know, I'm the worst at this, right? I'm the worst at, because of my experiences as somebody who's been fired because of a diagnosis, I'm the worst at this. I don't do a great job as a director on this. And so it's really around always, I go back and I ask, you know, hey, what's going on? You know, what's happening, and try to use that trust that we talked about earlier to have a back and forth conversation, try to figure out, you know, maybe somebody hasn't ever asked for an accommodation before. And maybe they need something that's a little bit outside of the box around accommodation. And so listening and then maybe troubleshooting that with somebody is an important way to go. But at the end of the day, there is a job to do, and we need to, move forward on and just being really direct and honest, and having that dialogue, I think, is important.
Great, thank you. Yeah, Jesse, you got like 30 seconds.
Got it.
Go
Really,
ahead.
lot of research to help us understand from leadership, working with employees, understanding the nature of the mental health diagnoses, what are the reasonable accommodations, and what HR can do, leaders can do, the immediate supervisor, to create that supportive space for a person to truly shine. A lot of work out there to help customize that. It is possible to do that. It's a great question, and that's where we need to be. Thank you so much.
Yeah. Well, I want to say thank you to everybody for joining. I want to say thank you to our panelists. Dr. Sharon, did you want to add in something? We are at time right now, but okay. Okay, great. So thank you to everyone so much for joining. Make sure you fill out the evaluation link, and hopefully we'll see you all on the next webinar call. Thanks.